It's a concern a lot of people have but don't always talk about. You go on a contraceptive method in your teens or early 20s to prevent pregnancy, and you hear from the neighborhood auntie that staying on it will affect your chances of getting pregnant later. So, does long-term use of contraceptive methods like birth control pills, for example, lead to infertility? Let's hear from an expert.
Birth control pills do not cause infertility themselves. If you look at how they work, they're basically stopping, or should I say pausing, ovulation. And usually once you stop the pill or the contraceptive method, your ovulation will then continue. Our bodies are quite smart. They will then continue ovulating. With the pill itself, it may take a few weeks or a few months for your cycles to normalize and for ovulation to begin again. And the confusion usually comes about where women may be using a contraceptive for a long period of time, and on stopping the contraceptive pill, for example, they may discover symptoms of a condition, an underlying condition that they may have had, but have not experienced symptoms because the pill had masked its symptoms or help control the condition. So if you're using, for example, an injectable, okay, your return to fertility may take longer, 6 months to 12 months, for example. Whereas if you had to have an IUD that was removed, your return to fertility is almost immediate. So if we look at in terms of side effects of long-term use of birth controls, it differs from individual to individual, and it differs on the type of contraceptive that you are using. If you intend on falling pregnant immediately after stopping the type of contraceptive you used, you would look at contraceptives in that line of use. Whereas if you are not intending on falling pregnant anytime soon, in the next year or 2 or 3 years, you may then look at a longer acting contraceptive method.